Hi, Dr. Pelto here. I want to talk to you today about two different types of walking boots. These are called a cam boot or a walking boot. This is a pneumatic one, meaning it has a little, like the pump that you used to see in the Nike shoes, and it's going to pump this up and give it more support. That's a short one, and here is a long one. So we'll start to talk about when you would use each of these. So if someone has an area that's inflamed on the foot, if it's more on the bottom of the foot, kind of up to the ankle area, then I use one of these short ones. Okay? So for example, if you have plantar fasciitis, if you have a pain in the bottom, on the front of the foot, an aroma, metatarsalgia, a lot of different conditions that just aren't getting better and they haven't got better with a cortisone injection, then you would use this short one. If someone has a problem that is from the ankle up, like the Achilles tendon, the posterior tibial tendon, the peroneal tendon, it's not going to help if the boot only goes up to here. It's not going to give it the support. So you actually have to have a boot that goes higher, and that's this higher one. So the higher one, when it straps on, it takes more of the pressure off of the tendons. And I want to explain how to use these. And also remember, we always have people get an even up with this, so you're not thrown off. Because if you notice, there is a nice little heel to it. So you can either wear a shoe with a little bit of a heel, like a high heel if you're a woman, or you can get one of these even ups, which usually works a little bit better. When you start to look at your device here, it has these straps that are on it, and you first have to open these up, and they come with some extra padding. So these padding you can use anywhere that you might have like a bony prominence or something on it. Okay. So what you do is you open up the boot, and you have the patient lift up their foot, and they put the foot right inside the boot. And make sure the pants is down. And then you take these and you strap down first the Velcro. And then you could add any pads that you would like, let's say if it's rubbing here or someone else. And then what you do is you strap down. Now, if you have any numbness or tingling with the boot, you would want to loosen it up, because sometimes if it's too tight, it can cause some numbness on the foot or it's uncomfortable. So then when you put that on, and then what you do is you can pump it up if you want to give it a little bit more support, and then if you want to get rid of that air, you can push that. So this is just one type of boot. There's a lot of different types. Some of the other uses you can use this for would include if you have an ulcer or a wound on the bottom of the foot, if you have an area that's painful. Now, one thing about if you're doing an ulcer, if you have a wound, what I recommend is you add a little insert inside to the bottom. So one thing you have to realize, these pads, okay, the goal or the desire, let's say you had a sore on your foot, you're not going to add it underneath where the sore is. You do actually the opposite. You have to add some padding in here. We usually use felted foam, and then you cut out an area where that ulcer is, and you put the felt with a cutout where the wound is, and then you can add some foam on top of it to take the pressure off of it. So that's what this boot is used for. And then I just want to show a little bit how the larger one, you can see kind of the difference in the size. Now, no one usually likes to wear these, but these really help if you're having bigger tendon problems. So you set the foot inside, you put the sock on, and once again it has some of this padding right here. This can be used to protect the foot if needed. And the only difference here is it has more straps on it, and it goes all the way up, and it'll protect it, okay? And it'll protect and help these tendons to relax. Once you're done, it has this little Velcro strap you can pull so it'll stick, and then you walk around. But the key to these is when you're walking with it, you're going to have this even up on the other foot. So this is going to even up so you're not going to throw your back off, your hip off, or any other problem. So these are a short and a tall walking boot. So just to review, the tall one is used for different types of tendon issues or ankle issues that aren't getting better, that are very inflamed. How long do you wear this? Usually if you're going to find benefit, you're going to wear it maybe for a week or two. If what you're dealing with doesn't get better after a week or two, you should probably see your doctor to see if there's something else that needs to be done, some other type of treatment. You're not going to wear these long term. If you're finding that these are helpful for you long term, you may have to make a brace to go with it. A brace can be used long term for certain conditions that this is going to help. The goal of this is to reduce inflammation and reduce pain. Once the pain goes away, then you can support it with either an orthotic or some type of a brace.